we're big on the basics. Before we even put a patient on testosterone, we'll help them with their nutrition.
Right.
We'll help them with their exercise. We'll help them with their behavior and their mindset.
Right.
And then we add the hormones. So
Absolutely.
when we do this,
anytime I give testosterone therapy, I tell patients, I'm like, I'm going to give you this testosterone therapy. If you're going to go home and eat a bag of chips and watch TV all day, nothing's going to happen, because it's just going to be like a drop in the ocean, and you're going to come back the same exact way to me in 3 months, and we're just going to stop it. I think if patients are not able to lose weight, exercise, sleep better, and change their habits, none of this stuff is actually going to improve. And I truly want to say you guys are just up to date with the literature, up to date with the studies, know the risks, know the benefits, spend time counseling.
For sure.
I think this is not what happens in the real
That's
world.
not right.
Especially now post-COVID, we have so many of these online clinics that are now prescribing testosterone. Some of these clinics do a great job in counseling, have actual doctors that are trained in testosterone therapy. Most clinics don't do all of those things.